And one of the major issues, obviously, we focus on, our core issue, is dealing with housing, particularly as it relates to those of you in the room who are real estate professionals. And why is that? Why are we having this press announcement today? Why are we announcing this initiative? Because of the partnership that we're kicking off today between HHS and NAREB and other real estate and builder professionals. Several months ago, with the kickoff of the Affordable Care Act, President Obama asked the members of cabinet, his secretaries, to look at how they could assist in making sure we reach maximum potential in the sign-up. My boss, Secretary Sean Donovan, asked us in all 10 regions to look at that issue, look at the likely partnership entities and organizations. We started with public housing and multifamily in that effort, looking at the tenants in those organizations, and said, how can we make sure that those folks, particularly those that were low income, would have an opportunity to get access to insurance. But as we stretched out a little bit and looked at some of our other partners, we said not only for those folks who are tenants living in public housing, living in those multifamily developments, we looked at our small business entrepreneurs that we work with, and NAREB is one of the great examples of that partnership. Many realtors don't represent big shops of 60, 75, 100 member organizations. Many of them are mom and pop organizations of husband and wife, one or two partners, maybe a couple of agents, maybe an office manager, who also have had trouble accessing the insurance market because of the cost. It's been a significant challenge for them moving forward. Many of them have gone bare. I was just at a NAREB conference, a NAREB midwinter meeting recently, and I would say with just a show of hands of the people in the room, probably about 50% to 60% of the people were going bare because of the costs were too high. Some are blessed to have a spouse that has coverage and they benefit from that, but the idea of that particular business having an opportunity to access the insurance market in their own name has been a challenge. So that's why we're excited about this partnership today. You're going to hear from one example, live example of one gentleman who's a member of your chapter who has accessed healthcare.gov, who has accessed the Affordable Care Act. But this is just the tip of the iceberg as we close on the last 2 weeks of what is being called March Madness. Those of you who are basketball fans understand all the bracket issues that are around that. I must say just 5 seconds, I'm a Florida Gator, so I'm really excited. Right now I'm a little biased about that. The energy in the room, but just saying March Madness, people get excited every year. And that's what we're excited about, the millions of Americans. As a matter of fact, Dr. Pamela Rochelle will talk about the 5 million Americans who've already signed up for the Affordable Care Act. When everybody said it wasn't going to work. When you heard from the media that the website wasn't working, you'll hear comments about that a little later on. But through all of those challenges, 5 million Americans have signed up. Some 139,000 have signed up here in Georgia. That's why we're happy to have this kickoff today. NAREB as an organization has 92 chapters in 35 states. 92 chapters in 35 states. That represents thousands of Americans and communities, their families, their supporters, their clients that need access to health care in this country. So today we're happy to announce the connection with NAREB, HUD, HHS, kicking off this national sign-up initiative to make sure not only here in Atlanta, we're going to have 4 different events over the next 2 weeks, starting with this event here at Empire Chapter. I want to thank Dr. Stacy Mollison for her leadership in this issue. You call Stacy up at 8 o'clock in the morning, by 2 o'clock in the afternoon, you got a partnership going on. She says, I'll call my board later. I'm not sorry to say that to you, she already signed you up. All you can do is rubber stamp it. But more importantly, what she did with the leadership of Tiffany Simone was to reach out to President Spivey. And that's what I knew of my relationship here. And we have had a great one between HUD, Atlanta, and this region, and the Empire Board. But President Spivey, who's the president of NAREB nationally, as you know, said, wait a minute, I want to take this conversation to my members nationally so that each chapter would have an opportunity to access this deal, not only for their members, their affiliates. We already have 3 events scheduled in the next week in Florida with the South Florida chapter. Other chapters are looking at this all around the country to push. So we wanted to make sure that HUD stakeholders, starting with NAREB, we're working with the folks here in this market with ARIA, which are the Asian American Realtors, the folks at NAREB, which is the Hispanic Realtors. We're working with the Builders Association of Atlanta, They're also coordinating an event, working with the folks in DeKalb County and Metro South. Those are all the things that have happened up to this date this morning at 9 o'clock. I can tell you this afternoon, tomorrow, as we push more and more, that March Madness, that energy is rolling because people are trying to make sure by March 31st at midnight that they not only have signed up for the Affordable Care Act, but more importantly, have given their family financial security. Because the number one issue for bankruptcy issue in this country is not dealing with paying your car note, not paying your mortgage, but it's healthcare costs. So giving people that financial security is a big deal. So we're excited today at HUD to partner with my colleague at HHS, Dr. Pamela Rochelle, who's been leading this effort for the region, reaching out to all the federal agencies. You'll get a chance to hear from her shortly on that point, how aggressive she's almost in a different city every day, trying to make sure we finish off strong. But as our next step is to make sure everyone knows that everyone here in Atlanta is committed to this. And we show that kind of commitment by working not only with our small industry organizations like NAREB and ARIA and the builders, but also with our elected officials. Chairman John Eves has been a leader on this subject. When Secretary Sebelius came to town recently, Dr. Pamela Rochelle connected her with Chairman Eves, such that we'd understand that not only is the city of Atlanta connected, you're going to hear from the mayor shortly, but the entire Fulton County area is connected, and you've got to have leadership. I'll end my comments this morning before I bring Chairman Eves up. When you hear later from our testimonial, you'll hear that people were hearing in the media and other places, the website's not working. The website's not working, don't sign up, don't call the number, the website's not working. Well, you'll find out after you break through all the truth, and you get to the number of what 5 million Americans have signed up, you've got to have some political leadership. People look to their elected leaders and say, what do we need to be doing? What is the truth? What is happening? Chairman John Eves has been a stalwart, not only in supporting the Obama administration, but been a stalwart in supporting the Affordable Care Act. We're excited to have him as a partner with us today. We're excited, more importantly, for him to be a part of this national initiative kickoff with NAREB, 93 chapters, 35 states, kicking this off so thousands of Americans get access to the Affordable Care Act. Please give Chairman John Eves a round of applause.
Good morning, good morning, good morning. Once again, I'm John Eves, Chairman of Fulton County, the largest county in the state of Georgia. I want to thank Ms. Mollison for hosting this event. And I also want to thank our partners, my friends, the Regional Administration of HHS, Dr. Pamela Rochelle, as well as my friend Ed Jennings of HUD. So this is really a great day for this region, a great day for Fulton County. The Affordable Care Act that was passed and is now law is not so much about policy, it's not about politics, but my friends, it's about people. And I think that that's what's been lost in all of this debate and all of this conversation and all of this contention. It's about people. We live in a great country, we live in a great state, we live in a great city, but the fact is there are millions and millions and millions of citizens, millions and millions and millions of residents in our country, in our region, in our state, in Fulton County, and the city of Atlanta who do not have access to affordable care, health care. And so this has been a good thing. And so as Ed Jennings pointed out, each time that the Secretary has been down here 3 times, I've been with her promoting the Affordable Care Act and the need for more people to be signed up. And so I am so thankful, and I want to commend all the partners who came together to form this partnership in terms of NAREB and your extensive reach throughout the nation to get more people signed up. Quickly, in the state of Georgia, about 20% of our population is uninsured. If you were to take those numbers down locally, roughly 20% are uninsured in this region and in the county. Fulton County has 1 million residents. That's basically 200,000 people who are uninsured. Fulton County, past X number of years, has been in the ball game through our support of Grady Hospital. Grady Hospital funds, supports 600,000 people every year, 200,000 of them uninsured. Fulton County has been in the game. We appropriate between $50 million and $100 million every year to support the uninsured. This is a good thing because, number one, it's going to help people out. Number two, it's going to lessen the tax burden on local taxpayers. It's a good thing. We have been very aggressive as a county government, getting out there through our libraries, through corporate extension. I've talked with people, we're getting people signed up, but the reality is we need to have more people signed up. We have a deadline, as you know, of March 31st, so I'm excited about this partnership. And so I want to thank all of you for being here. Thank you, Dr. Mollison, Ms. Mollison, for what you're doing, your leadership. We expect you to be out there on the ground to get more folks signed up. This is a great day. Thank you so much for this opportunity.
Next up, we have, again, symbolizing the national partnership we have. Again, this is not just a partnership with NAREB and the Empire chapter, the folks in this room. We have a representative of the national organization. You know, one of your former presidents, Jeff Hicks, is the second vice president of the organization nationally. So President Spivey could not be here today. We wanted to make sure that Jeff Hicks was here to let you understand what we're doing today, not only in the press, but for you, and be excited about it, is that they say you drop a pebble in a pond and it just ripples and ripples and ripples. The ripple effect around the country for this effort is one that we want to speak to greatly. So next up, you're going to hear from one of your own. Jeff Hicks is the second vice president of NAREB nationally. Look forward to hearing his comments. Chairman Hicks.
Good morning. Good morning. It certainly is my honor and privilege to serve you as the second vice president of the National Association of Real Estate Brokers. Administrator Jennings has already indicated that I certainly want to bring you greetings on behalf of our national president, President Donnell Spivey out of Baltimore, Maryland. And I have the distinct pleasure this morning of maintaining us on a tight schedule because we have our mayor here this morning. And I want to go ahead and bring him up because of his schedule. I would like to say this. It's obviously a distinct pleasure of mine as a native Atlantan to have the honor and privilege of introducing the mayor of our city. We have something extremely unique here in Atlanta. As a native, we're probably the only American city that for over 40 plus years have had distinguished African American leadership in a city like Atlanta. And I know we're all proud of the job our mayor is doing. He is one who is no stranger to the Empire Board of Realtists. He is one that is a proponent of economic development in our community. He has been here for us, not only for the Empire Board of Realtists, but for the West End Merchants Coalition and for all of our neighborhood groups. When we have had questions and concerns, he's always taken time out of his schedule to be here. And upon us having this particular event and knowing the importance of what we're trying to do to get the word out when it comes to the Affordable Care Act, he responded on very short notice of being here. And I would like for us to warmly welcome and to stand and give him a standing ovation to our great mayor, Mayor Casino.
I need to hire him on my staff. Good morning, sir.
I want to thank all of you. I don't know if this is on. I can just talk louder. First of all, I want to thank my friend Ed Jennings and really the entire group that's joined me this morning. But I'm going to make it plain. The Empire Board of Realtors is a critical organization in the life of the city. One of the biggest impediments to home ownership and one of the biggest problems that lead to foreclosure is when you have a healthcare crisis in our family, certainly among black people. And we have an opportunity right now to encourage people who typically would not have access to quality health care through the health exchanges to get covered. And the fact of the matter is, I'm here this morning because you have the community's confidence. It's no accident that I knew exactly where I was coming, and when they gave me the notes, I threw them away. We need your help. We need you to work your networks and to explain to healthy people, old and young alike, that they have until the 31st to get health insurance. Because what happens, especially in black families, is when there is a healthcare crisis, everything goes out of the window, often including paying the mortgage. Because when we have a family member that's sick, it's an all hands on deck situation. Whether it's our mother, our father, our husband, our wife, our spouse, our significant other, our child, son or daughter. And that impacts your business. Because if you look at the leading cause of bankruptcy, which the president discussed when he was moving this bill, it typically occurs when people have a major health crisis. And the doctor's bills are mounting and mounting and mounting to the point that families can't pay anymore. And the Affordable Care Act addresses so many of those issues. It allows people with pre-existing conditions to get covered so that they're not paying for the cost of care out of their pockets. It removes the lifetime limits. So when somebody gets sick, there's not a cap on the amount of money that is spent to try to get you well. And it makes it less likely that a healthcare condition will cause you to lose your home, which then weakens the neighborhood that you all sell properties in. And we just need you folks. The President of the United States has put it on the line for healthcare. And we literally have folks on the other side of us who are arguing against getting people covered and making people healthier. And they're actually fighting against a bill that is already reducing the country's overall healthcare costs. Prior to the implementation of the Affordable Care Act, healthcare costs in the United States were growing at 10% or more year over year, double digits. We've now got that down to single digits. The other side doesn't talk about that. The other side has not put up a bill yet regarding what they would replace it with or how they would mend it or fix it, because they don't want to fix it. They just want to get rid of it. The other side doesn't talk about how you can keep children in your household covered till they're 26 years old. You all know that that helps the black community. Don't let them do this to the president. Now, Ed and the folks from HUD and HHS can't put it in those terms, but I can put it in those terms. Don't let this president have his signature achievement, something that people have been trying to accomplish in the United States of America, which is the greatest expansion of healthcare benefits since Franklin Roosevelt, since Lyndon Baines Johnson. This man has taken all of this, and all he's trying to do is make sure that people can go to the hospital and be treated. We got 600,000 people in the state of Georgia who still don't have adequate health care. And if we were to accept the help from the federal government, we would get $33 billion in additional investment over the next decade to help people have healthier lives. And so when Ed gave me a call and when HHS gave me a call, there was no other place that I wanted to be. I just left Central Atlanta Progress to come here. That's where I started this morning at 8 a.m. But I know who people believe. Call your networks. People who you put in houses. Tell them to go room by room in the house and ask people, do you have health insurance? You've got some young people who now have health insurance for $26 a month, $30 a month, $35 a month. Y'all, they need to get it. And tell them, don't be afraid of the internet.
Exactly.
Because they can get this over the internet, they can get it over the telephone, and they can get it in person. So we have set up a system that allows people to get it wherever they are. So if you don't like going through the website, which has been fixed and which is working fine, You can pick up a telephone and do it old style. And if you don't like picking up a telephone, there are offices that you can go to fill it out in person. So every day through the 31st, I'm going to be somewhere talking about the Affordable Care Act. Because we can't let them do this to our guy. I mean, this is incredible. You all ever seen anything like this? The country was on the brink of depression when he got elected. The economy is now returning. Automobile industry was dying when he got elected. Automobile industry has been saved. Financial services industry on its knees when he got elected, coming back. You all's businesses coming back. 8.5 million jobs, unemployment below 7%. Killed Osama bin Laden and brought him to justice, whatever the word the president likes to use. Passed the most sweeping health care reform in the United States of America and has got a job approval of 43. Don't let them do this to this guy. We need everybody to get out here and get registered. I need you to call your pastors and tell them, don't let them do this to the president. And what's going to end up happening is good people are going to be able to go to the doctor with dignity. They'll be able to walk through the front door. You're not going to have to wait until something breaks in their body to be rolled in the Grady and pay 5, 6, 7, 8 times the cost. That's what this is about. So I'm going to let the other folks do all of the technical explanations and all of that. But I want to put it where the goats can get it. We can walk out here on Joseph E. Lyre and explain to people why in the world they need to figure this out. You're not invincible. All of us got something wrong with us. We need to put down the chicken, including me, drink more water. All of us got something wrong with us. The Affordable Care Act gives us advice on preventive care. Gives us advice on healthy lifestyles. And strengthens the country. And so, I want you to do it, and I'm asking you to help the president. God bless you.
Thank you, Mr. Mayor. And as you've heard now from Atlanta's 2 distinguished elected leaders, I know that Chairman Eves has got to get to 10 o'clock, so if he has to step out, I understand that. Now you've heard it from Chairman Eves, you've heard it from Mayor Reed, from the people you elect to give you public policy advice and lead. He is right that myself and Pamela can't say it as clearly and distinctly as he and Chairman Eves can say it. We thank them for that. And now we talk about the policy. We talk about 5 million. We talk about what opportunities there are. Then you, again, in your membership, have one member who can only tell the story himself of what he went through or what his costs were to save on average about $600 a month for his own pocket. I will tell you, I don't have the money that Chairman Eves and the mayor have. So $600 in my pocket on most days is a pretty good day. But it's one to talk about and then to have the example. So we want to have Mr. Thaddeus Dawson Jr. To come up as an appraiser, a member of the Empire Board of Realtors, a member of NAREB nationally, and talk about his experience, what this has meant to him, living example of what Chairman Eves and Mayor Reed talked about that can be an issue for some 600,000 that are Medicaid eligible if they were to expand, and the up to 20% of all Georgians that would have an opportunity. Mr. Thaddeus Dawson is an example of that. Give him a round of applause as he comes up.
Hi, everybody. My name is Thaddeus Dawson. I'm a real estate appraiser. I had no idea when I introduced Mr. Mr. Jennings in Las Vegas that it would lead to me speaking here today. So I probably would have kept my mouth shut. Being a real estate appraiser, our income ebbs and flows. But one of the major costs that I have pre-existing conditions. So I was unable to get health insurance for a long time as a result of that. When I was finally able to get health insurance, I was paying $985 a month. And so I've been paying that for the last few years. And I was blessed to be able to pay it is how I looked at it. But I looked at a bigger blessing when the Affordable Health Care Act came up. As most, I'm kind of hard-headed. So one of my buddies was saying, well, did you check the Affordable Health Care to see if you could get on that? And I said, no, it's not working. He said, well, did you check it? I was like, no, but I saw on TV it wasn't working. So I never tried it. So this went on for a couple of months. He said, did you try it yet? I said, no, I haven't tried it yet. It's not working. He said, well, you try it and then call me back. So I was watching a football game one night, and I got on my laptop, and I tried it, and it was working. Well, I went from one section to the other section, and it asked for a payment. I was like, what? I was looking for my wallet. It was in the car, so I was like, well, I'll do it tomorrow. So I got back online the next day, and it was still working. So needless to say, I went from paying $985 a month for health insurance to $374 a month.
Wow.
I'm very thankful for the insurance. I'm very thankful for the cost. And it's had a significant impact on me. And I think it could help a lot of others. But sometimes when you're watching television, it's not working. And then that's all you hear, so you buy into that. And I was just blessed that I had a very dear friend that dealt with me being hard-headed, and I was able to follow through. And so that's my story.
$600. $600. I wonder how many per month, how many of you all could benefit from having $600 back in your pocket per month, not 1 year, year 2, year 3, dealing with those issues. That's a wonderful opportunity. We're going to have Dr. Pamela Rochelle, the HHS Regional Director, talk about how we're ending March Madness right now. Dr. Rochelle.
And can we do a quick photo before everyone leaves? Joe needs to get a photo. Africa,
You go ahead and start, and by the time she gets up, we'll be there.
Well, good morning again.
Good morning.
I have been so excited all morning to hear the good news of how the Affordable Care Act has actually changed the lives here in Georgia and across the region. You've already heard the very compelling reasons that as individuals in the state of Georgia, as members of the African American community, as members of the business community, the Affordable Care Act, and specifically the health insurance marketplace, is an historic opportunity that we must all take advantage of. So I want to thank NARAB and HUD for this partnership that will actually change lives. You've already heard from one of your own this morning about the significant cost savings that he has been able to realize because he has enrolled in the Affordable Care Act. So your call to action today is to do two things. One, if you already have health insurance, please share this information with others that you know and love. Many people for years have been locked out and priced out of the health insurance market. And the Affordable Care Act is an opportunity for them to now engage in the right of health care. For too long, it's been thought of as a privilege, but health care is a right. So you should do a couple of things. One, use the 1-800 number that we have that is available 24 hours a day, 7 days a week. And that number is 1-800-318-2596. That's 1-800-318-2596. You can do a few things at that 1-800 number. Again, it's available 24 hours a day, 7 days a week. You can have questions answered in general about what the health insurance marketplace is, or you can actually complete the application process over the telephone. The other helpful benefit of the 1-800 number is to actually find out where local assistance is in the community. You heard the mayor describe the multiple ways to enroll, either over healthcare.gov, you could call the 1-800 number, or you can see an insurance agent or broker that's certified to enroll consumers in the marketplace, or you can speak with a certified application counselor. So use that 1-800 number and pass it along. You can also, as we said, go to healthcare.gov. The website is working well and is always available to start the application process. So we really do encourage you to share that information. A question that I often get is, so what happens after March 31st if I do not enroll? And exactly who is the marketplace for? So if you already have health insurance from a private company already, or if you have Medicare or VA coverage or TRICARE or job-based coverage, there's nothing for you to do in the marketplace unless you wish to change your private health insurance plan. So please help spread the word that there is nothing for those types of covered individuals to do. However, if you are not covered by any of those insurance coverages and you want to change your plan, visit the marketplace. If you are not enrolled and you don't have an exemption from coverage and you aren't enrolled by March 31st, you could face a tax payment when you file your 2015 taxes. That payment can be $95 per person in the household or $47.50 per child in the household, or 1% of your income. And what many consumers only hear is the $95. They think, oh, well, I'll just pay the $95. I won't get health insurance coverage, but it could be much more than that. And all of our estimates show that most Americans will definitely pay much more than $95. They would pay 1% of their income. So please enroll by March 31st. Take advantage of this historic opportunity. Pass along the 1-800 number and let your friends, relatives, neighbors know that they need to apply for themselves. What we hear a lot is that people look at someone else's situation and say, oh, this doesn't apply to me, perhaps I won't be eligible, but every single individual's health situation is unique. So everyone should really apply for themselves. The other issue is making sure that they ask questions. So use that 1-800 number to ask questions and get the correct information. So again, I want to thank NARAB for this partnership. I want to thank Ed Jennings for his leadership from HUD, and HHS is more than delighted to be here as a part of this partnership. We definitely could not do the work that we do across this region without significant partners like NARAB, without elected leaders like Chairman Eves and Mayor Reed, who are sharing this information with their constituencies across the great state of Georgia. So thank you again for all that you do to help the communities here in Georgia. Yeah, I'll turn it back.
I want to give you another minute on Pam and then open the floor up for questions. When this effort was kicked off and Secretary Sebelius was charged with implementing this, what she did is most times, and you all have had jobs, she pushed it down to her regional directors around the country. Dr. Pamela Rochelle is a regional director of HHS for the exact same region that I am, the regional administrator for HUD, except for Puerto Rico and the Virgin Islands. She's not blessed with that part of the world, but she's got the other 8 states. But it has 65 million people, the largest region in the country. She then reached out to all federal agencies and has chaired a meeting that is happening this morning. But she is almost, as I said, in a different city every day, because each federal organization, HUD, Labor, Commerce, SBA, all of the CDC, are all sitting at the table, led by Dr. Rochelle, who's saying, how do we reach out to partners? How do we do this by individuals, groups of 10s, groups of hundreds, the opportunity? And I think she would have me say, and I don't need to speak for her, but I'll do it in this case, is for those of you all who, one, first of all, like Thaddeus, who may have insurance and said, I'm covered, it can't help me. Does $600 help you?
Yes.
So today you will have the opportunity, with the help of Tiffany Simone and the healthcare brokers that are here. We have some healthcare navigators that are here. You'll hear from Enroll America after this, after you get some probably not so healthy breakfast that we'll all partake, because I want some of mine very, very shortly. But you'll get a chance to sit down with someone and say, let me tell you, I'm not covered, and how do I sign up? Well, let me tell you what I am paying. Is there an opportunity here? We believe that those, I would add that just to the list that Pam said, it's not just the folks who are not covered. So many people also can save money by getting a chance to compare their cost of what their coverages are now to what they could be if they sign up in this particular plan. Also, we are going to have 3 more. We'll give you a flyer. We're having an event tomorrow at the Atlanta Board Realtors. On the 26th, we're having an event at the DeKalb County Board, and the 29th at Metro South. All those events for you, your affiliates, your agents, your friends, to come and sign up to meet that deadline. Again, it is March Madness as we started. It's going to be friendly, it's going to be crazy. You're going to hear all kinds of numbers, but the numbers you're hearing from Pam, the 5 million number that she's got, these are the facts. She's paid to deal with the facts and put out the real information. 5 million Americans thus far. We're going to bust through all goals and aspirations on this and let not only the president know, but let your neighbors and your sons and daughters and spouses and significant others know. Now we have health care security because we have access to the Affordable Care Act. That is a gift not only from our president, from our members of Congress who decided to make this happen. Thank you all very much for having us. We want to take a couple minutes for questions. If you all have any that you want to ask Pamela, because I don't know the answer to any of these questions. If you have any questions that you want to ask, things you've heard, things you want to talk about as it relates to the Affordable Care Act, we want to take that time, then we'll have breakfast, and then we'll start the sign-up and education process. Any questions you all have? You will have not been bashful in the past with me, so please don't be bashful with her. Yes, sir.
They're saying that there's different levels of insurance that you get based on your income. Can you explain?
Actually, there are different levels. We call them metal levels. And so it's actually the level of the plan that the consumer pays and the insurance company pays. So you can have a platinum plan. The insurance company would pay 90% of all of the related medical costs that you have, and you would pay 10%. If you have a bronze plan, of course, the consumer would pay 40% of their medical cost, and the insurance company would pay 60%. So it really is based on your particular needs. If you are a relatively healthy person and you don't have a lot of medical cost and you want assistance with paying for your out-of-pocket cost, you may choose a silver plan. Only the silver plan level will provide you with the out-of-pocket cost assistance and the premium assistance. So when you hear us talk about health premiums as low as Thaddeus described, lowering that to $300, we have some consumers that have premiums for 1 cent. We have some that have, did I see your hand? 1 cent? 1 cent premium, $50, so it really does depend. So the levels that you hear about are about what you want to pay out of pocket and what the insurance company will pay. But what you do need to understand is regardless of whether you have a platinum or a bronze plan, they all offer the same benefits. So just because you have a bronze plan or a silver plan doesn't mean that you have to forego the prescription drug coverage or the emergency room care. Every single plan is guaranteed to have all of the 10 essential health benefits. The difference is the amount that you pay out of pocket and what the insurance company pays. So consumers should not be fearful that choosing a lower level metal plan, a bronze plan for example, will not afford you the same type of health insurance coverage. The coverage is uniform, the coverage is the same, the cost is the difference in the plans.
Other questions? Yes, ma'am.
I know that there were discrepancies in whether doctors, would take certain insurances and things like that. Is there going to be, or is that a possibility?
That's a great question. Every single plan, before you choose that plan, one of the great features of healthcare.gov is what we call shopping. You're able to actually compare plans and shop those plans, not only looking at all of the benefits that are there, if they may have additional benefits like dental and vision. Some plans offer those additional benefits, but you will see the provider network for every single plan. So you can make an informed decision about which plan works best for you, not only based on cost, but also based on the provider network. So you will have full access to the provider network. You can look to see if your doctor is in that network before you make a decision about your plan.
Yes, sir.
If you have a plan and are you locked into that plan year by year, or can you change the plan say, for example, if you're in relatively good health now and you take the bronze plan, and then as you're getting older, you say, well, I think I need to move to the platinum plan. How does that affect, and is there going to be an adjustment, or is it going to be the same amount that you could have got, like life insurance, or is it going to be more because you're older?
That's a great question. So the opportunity to change your plan is at every year's open enrollment. So the plan that some individuals selected through this open enrollment, if for some reason they would like to switch that plan, they can do so starting in November of 2014. That's when the next open enrollment period starts. As far as whether you're able to change in the metal levels, absolutely. You can change according to your own personal needs, your own personal situation. Plans are not rated based on pre-existing condition, so just because you may have been relatively healthy when you purchased your first plan, when you decide to perhaps change the type of coverage, your plan cannot increase in price based on the fact that you now have a pre-existing condition, and you can't be denied coverage because you have a pre-existing condition.
Thank you.
Other questions? Yes, sir.
You said that each of the plans covers the 10 essential health benefits.
Yes. What are they? So you have emergency room care, rehabilitative services, you have mental health and substance use disorder, prescription drug coverage, you also have hospitalization, and a few others.
Those are the main ones.
I give a round of applause Look at that. You got me right there. Look on the internet for other stuff.
So, as I was saying, dental and vision are optional for adults in some plans, but children, every plan must cover pediatric and vision care.
Other questions? Yes, sir. You got. Oh, okay. Yes, we'll do one more. Let me get one question, then we'll do one more testimonial.
What are the factors used to determine the cost of each individual monthly payment, or such as income or age? Are those factors? Will they increase the cost of care?
There is a ratio for age, but there's a cap on how age can be factored in. So it's a community rated plan, and so that's why pre-existing conditions are not a part of that. As far as cost, we do look at your income to determine if you're eligible for financial assistance. So if you're between 100 and 400% of the federal poverty level, then you are eligible for premium assistance. So to give you an example, an individual making less than $11,000 or so a year would be at the 100% of poverty. An individual making $45,000 a year would be at the 400% of poverty. For a family of four, a family of four making $95,000 a year is at the 400 level of poverty, and all of those scenarios would entitle an individual to financial assistance. Basically, 6 in 10 individuals are eligible for financial assistance. 94% of Georgians are eligible for some type of financial assistance.
I'm going to close out and give the issue back to Stacy and Tiffany now with asking you a couple of pointed questions, since we're inside the family. We don't have the press here with us, I don't think. So let me ask the pointed questions I asked out in Vegas for the folks that are in the room. How many of you all do not have health insurance? Raise your hands high. Raise your hands high. So the Affordable Care Act is for you. How many of you all have high cost premiums that you pay for your health insurance?
Everybody.
Well, everybody got to raise your hand. Everybody. So that says to me that as I hand it over to Tiffany and Stacy to give you another testimonial, you cannot leave today. We're going to lock the doors. You cannot leave today without hearing from Enroll America, talking to a navigator, talking to the healthcare brokers today, to spend, they say 15 minutes with Progressive to save money. Can you spend 30 minutes, okay, to talk about your health, to talk about, first of all, the cost in your pocketbook first, to talk about making sure your families have coverage and you're safe from bankruptcy, can you do that? So make sure if you have that unhealthy breakfast that I'm going to be sitting with you as well, make sure you spend that time. But let's let Tiffany close us out with her comments, but hear from one more testimonial who has benefited from the Affordable Care Act. Ms. Stacy.
We're really excited about this. Thaddeus came up and talked to you guys, but now I'm finding out that Gene Kimpson also was someone who benefit tremendously. But our secretary, Ms. Shani Aldridge, was also someone who benefited tremendously, and Shani's going to tell you her story briefly. This is Shani Aldridge.
Hey everyone, I'm Shani. And so I was talking to Stacey and I was like, I have insurance, my daughter and I, and she's like, what? But when it first rolled out, I was like, that's not gonna work for me. I can't afford it. I just knew right off I couldn't afford it. Went online before it came out that online was kind of a troublesome thing. And I was like, oh no, it won't even work online. I can't do this. Then they fixed it. I went online again and I, was typing in some things and it still seemed like it was just too expensive and I was just not convinced it just was not gonna work for me and my daughter. And so we had the snowstorm and I had some downtime and I said, let me just call because clearly going online, I'm afraid, I'm nervous. So I called, the lady was so nice and I told her, I don't have any money. So let's start with the lowest plan you have. And so she started at the lowest plan and it didn't seem too good for us, and then she went up a little bit more. And so my daughter and I have insurance for $95.
Wow. Wow. Thank you, Shani. And Jean, just quickly, if you could just stand and tell us about your story.
Well, my story is my husband and I are seniors, okay? We're seniors with no health problems. Okay, we're not on any meds. We don't have high blood pressure, any of that. And we were able to get affordable health care, I'll say very low. Very low.
How low?
You don't want me to tell.
I want you to tell.
$79 for dental. That's full everything. $16 for vision, because I do need some reading glasses. And because of our age and our health that we're in currently is 1 cent.
That's a dime for a year. A dime for a year. Add 2 more pennies to that. A dime for a year.
Can we expand on Simpson's dental?
We'll do that after we want to close out and follow the agenda and just close out, and then we'll go into specifics. You had a question?
I had a comment. I was saying, and I was like, I keep hearing all of us as real estate professionals say it could be too high, it could be whatever. But think about it from this perspective. I remember when everybody was fighting against the affordable health care, and I was one of those ones rooting for it because I know what it is to go have a medical emergency. You have health insurance, and then the plan kicks you off when they see that it is a medical emergency. But really, then I really don't have the money. Okay, so before you say you don't have the money, think of and put a value on your health care, because you never know when that one thing could happen. For me, I could have hemorrhaged to death. But our health care system, the way it was, they would have the audacity to kick me off of a plan that I was already paying for. So now we have a president that put a plan in place so that the insurance company can't do that. But then we have people saying, I can't afford it. Well, I say your health is more valuable than any house that we could sell, any land that we can sell, any building that we could sell. I just encourage you all to just